Welcome to Public Health Matters, where we talk about matters in public health. My name is Jane Goodman, and I'm joined today by Dr. Silvia Sironich-Kalkan from Harbor Homes. Welcome, Dr. Silvia.
Thank you.
We're really glad to have you here today. And what we usually do on these shows is we start with a COVID update, so I'll give that, and then we'll look to you for some medical advice on maintaining safety during COVID, just to start the program. So globally, we have 110.4 million cases and 2.44 million deaths. In the United States, we have 27.9 million cases and 493,000 deaths. We send our sympathies to those who have lost family and friends during these difficult times. Looking at Nashua, we see that to date, we have 6,258 cases of COVID-19. This week, we have 242 active cases. Our new infections per 100,000 is 379.4. This is down quite a bit in the last 2 weeks, but as you can see, it is still red, and so it is still puts us at substantial risk of community transmission. Our 7-day positivity rate is 6.8%, also lower than it has been. We've turned yellow here, a few more percentage points, and we can turn that green. We like to be under 5% in order to feel that community transmission is somewhat under control. In Greater Nashua, we have a total of 13,445 cases to date, and we have 478 active cases. If you look at the map to the right, we have a full state map, and I brought this along today just to let people know that Nashua, down at the bottom, is not so dark anymore. It is not the darkest color on the map anymore, and so we have seen rates decline in our area, and that in part is due to community efforts to mitigate the transmission of COVID-19. That's through mask wearing, hand washing, staying home when you're sick. So we appreciate everything that people are doing to keep our case count declining. Looking at the next graph, you can see that on the far right, for this week, we're still about the same as far as our case counts per week. We're kind of plateaued there for the last 3 weeks. Hopefully that will continue to go down and won't be so stubborn when we see it next week. Our percent positivity in the state of New Hampshire right now is 4.6%. So for the state, they would be green. However, for Nashua, our percent positivity is still yellow, or at 6.8%. People ask how we arrive at percent positivity. We look at the average number of positives each day over the average number of tests each day, and that gives us 6.8%. We do this over 7 days so that things can have enough time to settle out in case there's one day that there's a large number of tests. So Dr. Silvia, tell us, we talk about when should someone go and get a test for COVID-19?
Everybody who has symptoms, cough, shortness of breath, fever, change of the taste, it should go and have a test. Yeah. Also, people that was close to any person that was tested positive and it was less than 6 feet of distance and did not use mask or even using mask, it should go and test just for precaution, because for more than 15 minutes that you are close with a person, the possibility of transmission is very high.
Absolutely. And one thing I'm wondering, because you see this in your daily practice, you are practicing and seeing patients all the time, that some of the symptoms can be very subtle. They can say, oh, I always have a sinus headache, or I always have headaches, or I always do this. And when I talk to people doing disease investigation, they say, oh, I thought it was just a cold. So are you hearing that in your practice, people kind of ignoring the mild symptoms and not realizing that they could possibly have COVID-19?
Sometimes people ignore for the first 2-3 days, And then when it's a normal call is 2-3 days, and I'm gonna get well. And when they don't get well is when they feel that they need to go and test.
Yeah.
And most of them that they have symptoms, they test positive.
Yeah, so we've also heard a lot of this loss of taste and smell, where they might feel that cold for a day or two, and then when they stop being able to smell and taste, they really go, aha, something's
Yes.
real. Because apparently, and I haven't experienced it, thankfully, but apparently that's a very odd sensation when you can't taste things and when you can't smell them. So.
Yeah, that's, I did not have the experience either, luckily, but the people who lost the taste feel that it's very disturbing, because they cannot eat, they cannot smell anything, so it's when they really come for testing.
Right, right. So, and so other symptoms, nausea and vomiting, fatigue and muscle aches can be a symptom.
Can be diarrhea too.
Diarrhea and chills.
Chills.
So chills prevent.
Fever.
Yeah.
Sometimes with muscle, people who have muscle aches and think that it's a simple flu, and they say, oh, I have the flu, and then they feel that they have to test. And sometimes they make a comment during, we do a lot of telehealth visits, and, oh, today I don't feel good. I feel so tired. I want to sleep longer. Mm-hmm. And we send them to the clinic and ask them to go and test. And we do have some positive cases on that.
And I know you do have testing at Harbor Care on Mondays from 3 to 6. You have a clinic open to the public that if they make an appointment, they can go get tested. So that's an excellent resource in the community as well. And we often publicize that from our own point of view, because we moved our clinic from that nice downtown location to Daniel Webster Highway, which just made it harder for people. So there is that option to go to Harbor Care in Nashua and have that test on Mondays.
Yes, we changed the time. We are doing now from 3 to 5.
Oh, from 3 to 5, okay.
From 3 to 5 on Mondays. And if they call and register, it's much better for us, because we can organize the time. Mm-hmm. And if there are more people registering, we are going to, of course, extend the hours again.
And so you mentioned you get tested if you have symptoms or if you're exposed to COVID-19. And so we just want to remind people, if you know you were exposed to a positive case, we want you to stay home and avoid contact with people outside of your house for 10 days to, of course, monitor for symptoms. Get tested 5 to 7 days after you've had that close contact. Please do not get tested at the ER. We say this week after week because we want to keep that resource clear for true emergencies. So there are resources in the community where you can get tested beyond Harbor Care, beyond our clinic on Tuesdays. Many of the pharmacies are doing it. I've noticed the turnaround time has increased. So decreased, I should say, excuse me. But we're not waiting as long for results. So that is really good, and that's good for control as well, because the sooner we can let someone know that they have tested positive for COVID-19, they can start taking those precautions. And the other thing I like to emphasize is that if you have symptoms and you go and have a COVID test, don't go out afterwards. Wait until you get your results, please. Because it's very, that's how it's going to spread. If we just kind of go about our business, it's just a cold. No, you had a reason for that test, so please, take those precautions. And again, if you were exposed for 10 days, you get your test, but you don't test out of quarantine, and that's an important thing.
And the important thing is going home and talk about quarantine and the difference between quarantine and isolation. Mm-hmm. Because when somebody is positive and we specific say isolation, because need to be in the house, in a place without the other people who lives in the household, not being around. So the food has to be leave on the door of that person is, and it's a different thing than quarantine when you are waiting for a test and you don't know if it is positive or not.
Right. So it's much stricter, really, when you're isolating. You're trying to stay away from your other family members. Maybe designate a bathroom if that's available for just you to use. I tell people if that's not possible, just wipe down the surfaces really well, crack a window if there's a window in there. And then if you do need to leave your room, wear a mask.
Wear a mask and wash your hands very often.
Yes.
Use the gel if you cannot wash constantly your hands because you're in your room. But try to keep as much of isolation with your utensils and everything at home, just not to get the rest of the household exposed.
Right. Right. So we do ask people if you are diagnosed with COVID-19 or if you are not, we ask everyone to take personal responsibility for this virus. Stay home if you are sick, except to get your medical attention. Wear a mask when you're in stores, offices, and other public places. This includes restaurants, houses of worship, and other businesses. If you're working, if you're back in your office, you need to wear that mask inside your offices. Avoid large and small indoor gatherings. Keep a distance of 6 feet from those not in your family. And as you just said, wash your hands often, at least 20 seconds in warm water. So let's talk about what you do on a daily basis. You're the medical director for Harbor Care. How long have you been at Harbor Care?
Since 2012.
Okay.
I began to do primary care for a few hours. In 2014, I became the medical director, and I'm sharing half of the time seeing patients for primary care and substance use disorder, and the other part of my time doing medical directions, supervising all the my providers and running part of the medical director has to run about that.
Yeah, some administrative pieces.
Some administrative pieces.
And so you're working a lot, you said, with substance misuse.
Yes.
Have you seen a difference pre-COVID and now during COVID? Has there been an uptick? Has there been a slowdown? I mean, what are you seeing in your patient population?
Our patient population is with substance use disorders. It's more difficult. First, because we moved to telehealth, and some of them they have not specific communication or telephones, but they come into the clinic to do the urine test. It's not the same like going to the lab, and so some of them has been with very hard time. I'm glad that we are trying to bring it back again, and we have a very good team that they called and they try to. When they no show to the visit, we follow up and we try to get it back to treatment.
Yeah,
but we did
much easier in person.
It's much easier. Sometimes, if at least they come once every time, one telehealth, one coming in person is much easier than having sometimes all the time on telehealth. Because of it's a different way to control. They cannot bring the film, so they cannot do. They don't want to go sometimes to the labs for the urine test. So, in general, those things are more difficult. And the other thing is being isolated because of COVID. They gave a lot of depression and loneliness, and that's got more possibility to relapse on the use.
So it's like twofold.
Yes.
That isolation and depression and that kind of lack of social engagement really has affected
Yes.
The drug misuse, the substance misuse, I should say.
The substance. Yes, but the good thing is we are reaching them out and they respond. Mm-hmm. Not everybody, but they.
Yeah, so it's good that you've managed to keep that community of patients. They're still coming. They're still reaching out. They've managed to reach them. You haven't lost them to follow up and that kind of thing. So that's good to know.
Yeah, and we didn't stop seeing them. The people who need to come to the clinic, I did not stop seeing them. Mm-hmm. So we fully PPE and we see them.
Right.
I don't think it's so. If we dress accordingly and we take all the measurements, we are able to see our patients in the clinic, the one that who really needs.
So that's
not
great.
Everybody.
I mean, that's really important. And a big shout out really to all the providers. You know, it doesn't go unnoticed. We really do appreciate what you're doing and serving our community.
Thank you. And I'm really grateful for the providers that I have, that they are willing to do too.
Yeah. So we also brought you here to talk about getting back to normal, if there's such a thing.
Yes.
Or to a new normal anyway. And we talked about, we have a little graphic from the CDC that will pop up here, but there's a few things that we can do, hopefully, to get on this path to normalcy, and that is get vaccinated, wear a mask. They've heard us say this so many times. Mm-hmm. Stay 6 feet from others and wash your hands often. So you've heard of 3. I want to talk about vaccination today because really we want to encourage people that when they are qualified for the vaccine, when their phase opens, to please reach out and please schedule that vaccine because that's just going to be critical to getting back to that normal. So we have 2 vaccines available. You want to talk about those?
Yes, at this time we have 2 vaccines available. One is the Pfizer vaccine, the other is Moderna vaccine. Mm-hmm. Both are in the state of New Hampshire, and we have accordingly what we get into the what we receive, and both act in the same way. They have a new science behind. It's called messenger RNA, mm-hmm. or mRNA, like commonly people name it, and it's a very effective and good vaccine. We have a 94 and 95%. 94 for Moderna, 95% effectiveness for Pfizer. And I know people, because it's new, they have so many thoughts behind the vaccine, mm-hmm. and they are hesitant about what is this mRNA doing. Mm-hmm. So as long as when the vaccine is going into the arm and the messenger RNA, what is have the construction of the protein that the virus have, like like a spike.
And we can put up a picture of the picture that everyone's seen with the red spikes. But that's really when we talk about spike proteins and what you're about to explain. Those are real spikes just under a microscope that we see. So we'll pop that up there, and we also have a second picture that shows the spike proteins.
Yeah, and the second picture is the spike that the mRNA will instruct the cell to build. So when that spike is in the cell, it will sense as something that is not common in the body, and the immune system will react to that spike, and it will create immunity, and it will create also memory for a next contact with that spike. So by the time that person have contact with the virus, that the immunity will react, and even if they have the disease, it's not going to take us to the patient to the emergency room or to the intensive care. And what we want to say is the virus is around, but if we have immunity, we have the chance to fight against the virus and prevent to have more people in the hospital and more death.
Right, so we really reduce the risk of serious illness.
Oh, yes.
And so we have another diagram that you actually sent along to me. So if you want to walk us through that, of what actually happens when the vaccine goes into your arm.
Yes, when the vaccine goes into the arm, there is the messenger RNA coding goes into the cell. And when the cell began to fabricate the spike, and when the spike is in the cell, it will activate the immune system. The immune system will, with the cell, will generate the immune response immediate, and it will generate also memory. So after fighting that spike of that infection, it will be a memory. So for the next contact with the virus or with the spike, the body will react and will act protecting that person.
So we talked about something prior to the show about people worrying that it could change their DNA. And you had a great explanation telling me that's impossible because the vaccine doesn't penetrate the nucleus of the cell.
Yes.
Can you just explain that briefly?
So some people are afraid of this vaccine change the genetic code. They ask so many questions about that. There is no way that the mRNA will move into the nucleus where the genetic code is. So what happened is in normal way, the cell, the nucleus does the mRNA to give the orders to the cell to do what they need to do. In this case, there is an mRNA from the outside of the body, which is the vaccine, and will instruct to do the spike. And immediately after that, this mRNA will be destroyed by enzymes. So in this vaccine, there is no virus involved, and there is no genetic code or any DNA involved in the vaccine. So I will say that people who is afraid of having the vaccine because they are thinking about the genetic code is nothing to think about or to worry about that.
Yeah. So, and we know that the vaccine is safe and effective. They were not rushed onto the market. There's a perception, because we've really never had a vaccine come out this quickly in our past history. However, what I often like to point out to people is that the SARS virus was being studied for about, I think, almost 10 years prior to COVID-19. And so this has been well studied, and it allowed the faster development of a virus, of a vaccine. So it's not like it's not brand new. It's what I want people to understand, that a lot of thought has gone behind it, and that it was studied in a diverse population, and with 30,000 to 50,000 people for both vaccines. So that's really an incredible feat that they did that, and so far we seem to be in good shape with the vaccine.
Yeah, because the mRNA technology is a technology that has been more than 20 years in the field, and it was using for other research and other things like oncology, so cancer treatment. So the people who works with mRNA, they know pretty well, and I think this is an innovation that can help a lot in the future too.
Yeah, it's a miracle of science, but there was so much science behind it before
There is
the
a
research began.
Yeah.
And then we also want to emphasize that when people are getting their vaccine, there are no placebos. This is no longer a study.
No.
This is the real thing, folks. So please don't even let that cross your mind. Everyone is getting the vaccine. Yes. And in fact, if you think about it, there'd be no way for us to track that. You would only use that if you were studying this. And
Exactly.
The studies are not going on anymore.
The vaccine works in your body immune system. And after 2 weeks of the second vaccine, you can consider ready to fight the virus if you are exposed.
So it's pretty amazing.
Either ways, don't forget to use mask.
Right.
And keep the social distance, because we need to have at least 75-80% of the population vaccinated to feel that the virus can really reduce the circulation with us.
Yeah, and so while we're getting to that number, I also say to people, we have to be a little bit patient. Mm-hmm. It's an enormous undertaking to reach a lot of these people, and we do have 13 fixed sites around the state that are open almost 7 days a week for some of them, getting vaccine in, doing this stuff outdoors so that they can remain safe. And it's really been an incredible rollout considering, and I think as we continue to have experience with it, we'll be able to do it more efficiently and get more vaccine in more arms. So
yes, that's the number one priority. When we have most of the people with vaccine, and the virus stops circulating, it will be much better, and we want to get probably closer to normal.
Yes, closer to normal would be good.
New normal.
I'll take a new normal.
New normal.
Well, I thank you so much for joining us and sharing your medical wisdom and knowledge with us. It's very important that people need to understand that you've been vaccinated also.
I was vaccinated. I get my first vaccine on December 31st.
Oh, you were early.
Yes. And my second vaccine on the 28th in January. So I'm fully vaccinated, and I'm already with my 14 days after. So
yeah, and it's a good feeling, I think, to know that
it's a feeling of relax.
Yeah.
Yes.
So we'll just keep trying to get everyone we can as those phases open up to sign up for a vaccine. And right now, just a reminder to everyone that we are in phase 1B, and that's for people 65 years of age and older, for the medically vulnerable under 65 with 2 or more comorbid conditions, family caregivers of medically vulnerable persons under the age of 16, residents and staff of residential facilities for people with intellectual and developmental disabilities, corrections officers and staff, and of course, first responders and healthcare workers that are not already vaccinated can sign up.
Anytime.
Anytime. And you can visit vaccines.nh.gov, or you can dial 211 if you do not have access to a computer. They can sign you up for the vaccine. And just a reminder that the Division of Public Health runs a Tuesday COVID clinic. Still important to get those tests if you are showing symptoms. That's every Tuesday from 3 to 5 on 154 Daniel Webster Highway. You can sign up online for a test, or you can call our hotline at 589-3456. As always, we thank you for tuning in, and stay safe out there.